Welcome back to Mountain Connections. Right now we have the opportunity to speak with the medical director at Park City Hospital. Dr. Wing Province is joining us. Dr. Province, thanks for being here today. He is with us and he's going to update us on everything that is happening at Intermountain Park City Hospital. I think he was muted, but he's with us now. Dr. Province, how are you doing? Nope. We are going to make sure that we find out. Oh, hi, Dr. Province. How are you?
I'm great. How are you doing this morning?
Doing really well. I definitely appreciate this update with the Park City Hospital with everything going on. I'm curious, how are the patients doing? How is the staff? Are you seeing an increase in patient load? And what is the emotional health and overall physical health of all of the staff members at Park City Hospital?
Currently, the morale is doing really well. We have plenty of staff, fortunately, right now. Plenty of PPE, plenty of supplies, plenty of equipment, plenty of beds. The caregivers here have adapted to different roles, especially those who used to work in the operating rooms. Now that we've limited surgeries to only emergency surgeries, a lot of folks have been deployed to other parts in the hospital. But overall, spirits are up. People are willing to pitch in. People are being flexible and helping out throughout the whole hospital. As far as our patient loads go, they continue to slowly increase, but we're ready for them.
And Dr. Province, you are an emergency medicine doctor. How is the emergency room? Is it busier than it normally is? Where is it at?
You know, it's interesting. We set up a drive-through recently. Before the drive-through was set up, we were incredibly busy screening a lot of patients. Now that we have the drive-through set up over at the ice arena, the flow of patients coming to the hospital has decreased, and we have a lot of folks who are trying to be considerate of the hospital, and they're not coming in, or they're scared to come to the hospital. And for those folks, we want them to know that they're safe to come to the emergency department for their emergencies. I've had a few folks say that, oh, I'm worried about coming in with my chest pain because I know you guys have more serious things to worry about. Well, you know what? Chest pain and heart attacks are serious too. We want them to know that they can come, they can feel safe. We are all wearing the appropriate personal protective equipment. We actually have a second way that we intake our patients who are here potentially with COVID-19 that keeps them separate from everyone else. So folks can come in knowing that they're going to get great care like they have over the past 10 years and know that they'll be safe.
You mentioned how individuals can be tested at the Park City Ice Rink. It was announced yesterday that Intermountain is partnering with University of Utah Health for this testing service. How has that changed? I know that you've been sending individuals to the ice rink for testing for quite some time, but now it's a little bit different, so explain that.
Yeah, so yesterday it was announced that we joined a partnership with the University of Utah at the ice arena for screening. You know, Summit County has been especially hit hard by the COVID-19 pandemic. Our rates per capita rival some of those of New York and other places hit really hard on the East Coast. Partnering with the University of Utah brings us more resources and staff to help with the testing and assessment so that more people can get tested if they are not feeling well. You know, Intermountain, we have a history of partnership with the University of Utah. When our two institutions combined, we created the Primary Children's Hospital. And so with that history, we have a record of coming together in a time of need, and this is exactly one of those times. The nice thing about the ice arena in Park City is that it provides easy access for cars to come through. A lot of folks know where it is, and it allows the cars to serve as a barrier for folks to keep appropriate social distancing, and for our caregivers to also maintaining healthy, safe distance so that they can screen individuals and also obtain samples if needed. You can also go to our symptom tracker. We have an app that you can actually download. If you're worried about having COVID-19 and you are a little reluctant to go out, you can download that symptom tracker. And then we also have a hotline you can call. I believe it's 844-442-5224. I had to refer to my notes there for a minute. Calling ahead is not required. Folks can come over to the ice arena even if they have any concern. We welcome them. The hours there are Monday through Friday, 9 a.m. to 6 p.m., and then Saturday and Sunday they're open from noon to 6 p.m. And folks have expressed a concern about cost, and they don't need to worry about that. All insurance carriers are covering the cost, and if you don't have insurance, the government has made it possible for everyone to get screened. So please come over. We've been seeing an uptick. Our first day when we were over there getting it set up, it was actually the day that we had the earthquake here. Just a handful of people came, then maybe 20, and recently we've had about 100 people a day. And it's still not enough. Please come if you're having symptoms and know that you're welcome to come.
And Park City Hospital has a labor and delivery department. I'm curious how the virus has changed restrictions with patients who are in labor. Can people have someone with them when they go into labor? How has that affected mothers who are going into labor?
Yeah, that's a great question. Thanks for asking. With this COVID-19 pandemic, we're trying to put the health of our community first and foremost. And as a result of that, we've had to make some tough decisions. And one of those now with labor and delivery is that a mother coming in labor can have one support person with her while she is giving birth, which is quite a change. Typically, I remember with the delivery of all my children, we had lots of family members coming, but now that puts those folks at risk and potentially puts the mother at risk. So if that one person is COVID-19 positive or potentially under investigation for COVID-19, we ask that that support person not come and that the mother find another support person until just to ensure the safety of the mother and all involved. We know that's different in the past and that this can be difficult, but patients we've seen have become very creative using technology and ways to be a part of the delivery, and we encourage that.
And, I think we're all in need of some inspiration right now. Any inspiring stories coming out of the hospital, whether it's with patients or staff, during this really busy, tough time?
Yeah, Christine, there's several I could think of. One that comes to mind is Liz Stevens. So Liz is a 3-time Olympic skier who retired from Olympic competition. She usually works with our patients who are going through surgery and after their surgery here at the hospital. But since we're not doing elective surgeries anymore, she's been redeployed, and she is actually helping the usual cleaning of the hospital and the extra cleaning that we're doing at this time with the pandemic. And despite her celebrity status here in Park City, she's cleaning walls and doing whatever it takes to help our hospital fight this pandemic. And it's that selfless, no ego attitude that Liz exemplifies that I think captures the spirit that we're feeling here at Park City Hospital. That really exemplifies what a lot of other caregivers are doing, but Liz's story in particularly stands out to me at this time.
Well, thanks so much, Dr. Wing Province, for talking with us today. We are so grateful for all of the medical professionals and staff on the front lines right now, serving our population and really working tirelessly to help us and help out during this time. So thanks, Dr. Province, for taking the time for speaking with us today.
Thank you. We feel the love and support, and we really do appreciate it.
All right, we have more coming up right after this. We're going to take a quick break and be right back.